So here on our list, we now see that a patient has arrived and been checked in. You can click the blue hyperlink to then go into the record, go ahead and do your chart review. In order to do your chart review, one of the easiest ways is to go to Vitals. You can view all of your vitals along with the weight to view any trends. Then you can go to administered medications to see what medication they're on, whether it be a LARC or the depot, and also see when the last dose was. And then for labs, you can't go to this tab just yet because we are not interfaced with our lab. You must go to patient encounters, pull up that patient encounter, and then if there are any orders, you will see them here under Orders tabs. There will also be a blue hyperlink here you can click on to view those results. So that is one of the easiest ways to find your last lab. Once the patient is checked in, the note is already going to be created. You'll click on it. And the first thing you're going to do is when you call the patient in, you're going to go ahead and update the medication list. Make sure everything is current. And let's say that we need to discontinue something because they got a LARC now. You can say now has LARC and just update this medication list to make sure that what they have here is actually what they're on. Once you do that, mark as reconciled. That means you have gone over this list with the patient and everything here is accurate and up to date. For allergies, same thing. You will go through here, and once you review this with the patient, you will mark it as reviewed. The next step will be to go to your note and document your vitals and your chief complaint. And put in your vitals and height and weight. And save. And then you can go into your form that you're going to use. So click Forms. Go to Shared. And if you're using anything reproductive health, you're going to always go with this one. If you're doing a telemedicine visit, it's going to be either the male or female telehealth. For nurse workflow, though, it's always going to be this top RH clinical form. We have moved the QFP type of visits to the front page because we've also added this lab only visit encounter type and the follow-up note type. So depending on what the patient is here for, you go ahead and select the appropriate gender identification and what QFP visit they're here for. For the history part A, what you can do is you can split your screen. You can go to your last encounter and you can review that history. All right, in reviewing the history with that patient and you see that nothing has changed, take a note of what date this was. You can bypass then the history part A and go straight to part B. You can rejoin your screen so it's larger. And you're going to say nothing has changed on your history and go ahead and put in your date. This history was reviewed, the history that was reviewed with the patient was on the 18th or whatever date. If you have to follow up on any appointments, like we've ordered a colpo or a mammogram or whatever, you can click here and you can say pending appointment for colpo, whatever you need to say. Or you can say no show, rescheduled, whatever you need there. At this point, this is the same workflow that we've been doing. You will continue to go through the appropriate tabs based on and complete it based on the requirements for that type of visit according to QFP. Just as a reminder, if you ever wonder what absolutely has to be documented, everybody should have a copy of this in their clinics. This is the checklist for the different types of services. This one is for women, next one is for men and their type of services. And if that section is required according to the Quality Family Planning Guidelines. And this is what we base our documentation on, as well as the chart audits, to ensure that if it is required, we are completing it in the EHR. Just to let you know also, there is a Qfp app, not only for the desktop, but also for your iPhone. If you would like, it makes it easy just to click it up, make sure that you are documenting the correct things for that type of service for male and female. Going back to our electronic health record, you would also document your exam, A and B. And then as a nurse, you're going to come here, you're going to select the appropriate ICD-10 code, as well as any high-risk sexual behavior codes, which will flow automatically into the orders and charges cart. Make sure you also continue to fill out your end of contraceptive method, any counseling provided, and at the very bottom, click here that you have reviewed all this with the patient, the questions were answered, and instructed to call the health unit if any questions. Remember that if you do a pap smear, to check here yes, and you'll have to go in later after that pap smear returns to document the results of that pap. You can go ahead and save your documentation and then go into your orders charges cart. Once you go into your cart, you will see all of the diagnoses that were selected on the template have flowed over. One of the things that is coming is the identification of the primary diagnosis. When the new update for Entergy rolls out, you will select the primary diagnosis, right-click, and it will say Make Primary Diagnosis. Because that upgrade hasn't happened, I can't show you, but just remember you will be able to right-click whatever you decide is going to be your primary diagnosis. The next thing you want to do on the orders charges cart is always start left to right. This prescription tab is only for APRNs and MDs. Labs is going to be used after we become interfaced with our electronic health record. Remember how I said earlier you can task for multiple screens? This is another way to task something. Charges, make sure you charge for your time first. This list will be your nursing E&M codes, be it your 99211 or your T1001. Select whichever is appropriate for that visit. OPH labs are all those send-off labs as well as the point of care labs. Please make sure you select any of those. Go under the high-risk heterosexual behavior, order one at a time, and save between. That way, if something is rejected from the lab, then we can cancel or void just that one order and not have to void the entire requisition and then reorder. For point of care labs, click on the point of care, go ahead and result it immediately, and close that order. Once you hit OK, because the order has been resulted, it's going to drop your charge. This outside lab is mainly used for other programs such as CYSHCN, TB. I do have the HPV typing and PAP under outside lab because that is a send-off, and we do not charge for that lab. CDD charges for that lab. Go over to procedure, and if you have any reproductive health procedures, you will find that at the bottom. The one we have listed is expedited partner therapy, which is used by APRNs. If you are making any referrals, this is where that will come up. I noted that this patient had an elevated blood pressure, so we will need to go ahead and refer to the primary care provider for blood pressure. Select that. Once you hit save, it's going to come up with the correct referral form. You will preview that form. You can hit edit, and then you can complete the referral form here. Once you complete this form, save it, and you can hit OK to print and hand it to the patient. Okay, if you do have any patients that require mandatory reporting, I have already put in the DCFS reporting form here, and when you open this up, it will give you further instructions on how to report, whether you need to call them at the 1-800 number or if you can send in this online form. Reproductive health medications. If you will remember this tab as anytime you open that stock cabinet to grab something out of the stock inventory, you're going to need to go here to select what you have given. And then you're going to go here to administer that medication that you just gave. And this is where you would document also your lot number and expiration date, site, route, all of that. Reproductive health supplies is where your condoms, foam, and film are. And once you finish with your orders charges card, hit save. And then go back to your note, and you can go ahead and sign this off if you are done. And then sign it off, sign. Don't be afraid to go ahead and sign off your note, because you can always go back and you can open this back up and amend it if you forgot to document something. So don't be afraid to go ahead and sign it off. Putting it into the signed off mode, make sure that nobody can go in and change your documentation. The next thing I'd like to show you is the new PH 415 form that everyone should have. As a reminder, anytime you give any medications to someone who does have insurance, go ahead and complete the PH 415, and you will send this to Leah. Whatever you give, you're going to want to check that box depending on the dosage and how many that you gave. So pretty easy. And then you go ahead and fill out the top, put the patient label, and then make sure you put the barcode label on the sheet. Not only does this work to replace your stock, but they also bill for that medication. One of the last things that you're going to do now is you're going to go over to the problem list and make sure that this problem list is updated. You can go to your orders charges screen, and any problems that you have here, you can right click it and copy it to the problem list. So that when you do go to the problem list, you can right click it, hit patient education. It takes you into Medline. This is required for APRNs and MDs for meaningful use. After you look at the patient education, it's going to ask if you want to send this to the patient's portal. And if they have signed up for the portal, that is what is recommended. You hit yes, and it goes to the portal. If the patient has not signed up for the portal, it's going to give you the option to print it so they can leave with their patient education. After you complete the patient education, you should be done with this encounter. The orders charges are signed off, note is signed off, problem list is updated, and patient education is done. So therefore, you can X out of the patient and mark that patient out.